Presenting a patient to your preceptor involves providing a concise and organized summary of the patient's relevant information. Remember, it's important to tailor the presentation to the specific needs and preferences of your preceptor. Present the patient information in a concise, organized, and focused manner so that the relevant information is conveyed effectively.
Here is a framework to use for presenting your patient. Present the patient's chief complaint and reason for their visit. Use the patient's own words if possible. For example, "I'm constantly urinating, doc." Provide the patient's basic demographic information, such as age and gender. For example, Tommy is a 75-year-old white male seen in the clinic with a new onset of urinary frequency, urgency, and dysuria for 3 days.
Present the HPI. Provide a brief chronological account of the patient's symptoms, starting from when they first noticed the issue. Mention any exacerbating or relieving factors. Include any self-treatment or interventions attempted by the patient. Remember to use old carts, as described in the previous videos. Then summarize the patient's relevant medical conditions, including chronic illnesses, previous surgeries, and significant medical events.
Highlight any medications the patient is currently taking. Examples include: patient has a past medical history of diabetes, BPH, and HLD. Patient is on metformin 1000 milligrams BID, Lipitor 40 milligrams PO daily, and Flomax 0.4 milligrams daily. Make sure to share the patient's social and family history. Include relevant information about the patient's lifestyle and social factors that may impact their health, such as smoking, alcohol consumption, occupation, and living situation.
Make sure to mention any recent significant life events, changes in social support, or relevant environmental exposures. Mention any pertinent family history if applicable. Up next is the pertinent symptoms or findings from your review of systems. Focus on the areas related to the chief complaint.
Next, describe the key findings from the patient's physical exam. Make sure to highlight any abnormal or relevant findings that may guide the diagnosis or management.
Once completed, share any diagnostic test already performed, including the results and their relevance to the patient's condition. Follow up your assessment and plan by offering your evaluation of the patient's current condition and differential diagnoses.
Outline the proposed plan for further investigations, interventions, and management. Include any specific questions or concerns you would like the preceptor to address at this time.
And once you're done presenting your patient, be prepared to engage in a discussion or answer any questions the preceptor may have.